If you discover a suspicious spot, rough patch, odd-colored mole, or freckle on your skin, it's a wise decision to consult your GP or a dermatologist. Dr. Harvey Lui is a dermatologist-oncologist who is head of the Department of Dermatology and Skin Science at UBC. It is my pleasure to welcome Dr. Harvey Lui to Studio 4 to tell us more.
Good morning.
Nice to meet you. Interesting field. Almost everybody has a splotch or a blotch or a mole they're not sure about.
Well, that's true, and we now know that 1 in 5 Canadians is actually destined to develop a skin cancer, so it's the most common cancer that occurs in people.
That's high, 1 in 5.
Yeah. And it's actually increasing still over time. In Australia, it's 1 in 3.
Really?
Yeah.
Can we blame it all on the sun?
You can blame a lot of it on the sun, but not just the sun, but it's the way we behave in the sun. It's excessive, unnecessary exposure to the sun that damages the cells of our skin, and that's what causes the skin cancer.
When they do the math, are there certain countries, you mentioned Australia, other countries that are where people are more vulnerable because of the altitude, the dryness, the climate, what?
Well, it is definitely certain countries or certain geographic locations, certain climates where you have a lot of sun exposure, but not only the climate and the weather, it's the behavior, because we know that a lot of dark-skinned people who live in tropical countries, they avoid the sun and they don't have that high risk of skin cancer. So it's the combination of a lot of availability and taking too much advantage of it.
Sure. Does the color of your skin determine what kind of skin cancer you'll get? How does it affect?
The color of your skin does affect the tendency to develop skin cancer to some extent. It also does affect the types of skin cancer that may develop. So we tend to see a higher range or a higher rate of melanomas in people with light-colored skin. But that doesn't mean that just because you have dark-colored skin, you're not at risk. Everybody's at risk.
Aging. Aging, obviously. I don't know how we grow a spot overnight, but we seem to, or a rough patch, and you think, my friend calls them the barnacles of life. So how do you know when one of those barnacles is not a good barnacle or a good spot or splotch? What are the symptoms? Let's start with, how many types are there?
Well, there are how many different types of skin cancer? There are 4 major types of skin cancer. There's melanoma, which shows up as dark spots on the skin. It may look like an unusual mole. Then there's another type called basal cell cancer, which would show up as a growth or an ulceration or a sore on your skin. And that's also similar to squamous cell carcinoma. So squamous cell carcinoma, basal cell carcinoma, these are skin-colored spots that may be a little bit red and inflamed and sometimes scaly, and those are common. And then the last one is something called actinic keratosis, which a lot of people aren't as familiar with.
Okay, let's start there. AK for short, actinic keratosis, most common form?
Well, it is actually a precancer. Actinic keratosis is what can happen when you have enough sun damage that the skin starts showing little growths of scaly rough spots on the skin, and if it's not treated, it will turn into skin cancer. So we like to treat it at that stage because it's much simpler to treat it.
So at a doctor level,
Yeah.
how do you know if it's an AK or just a little rough patch?
Well, a lot of the rough patches actually are AKs, or actinic keratoses, and so what a lot of ordinary or regular people don't realize is, they're applying their sunscreen on their skin or they're putting on some makeup and they feel this little rough area, and they don't realize that little rough area might only be the size of a fingernail or so. That may actually be a precancerous growth, a AK.
Really, is it necessarily colored?
Sometimes it's scaly and white, sometimes it's red and pink, and sometimes it's just skin color, but usually it's relatively flat and it just feels like sandpaper kind of on your skin.
Well, we're looking at it now on a gentleman's head. I
Yeah.
assume it's a gentleman's head.
That is a gentleman's head, and you can see that rough red area right near the hairline. That's an actinic keratosis, an AK. That is very treatable, and if it's not treated, then it may turn into a real skin cancer, which would require surgery.
When you say very treatable, how so?
Well,
how do you treat it?
AKs, the damage in the skin is at the very top layer. It's right at the surface in the epidermis. And so we can use local treatments, either a cream, or we sometimes use liquid nitrogen, or sometimes we use a form of light therapy to treat the spot. And because it's right at the surface, we can attack it locally, the spot clears, and then the cancer is prevented.
Is there a special light you can put a patient under to see if they have precancerous
Yes, there
lesions
are. Yeah, there are types of devices, optical devices, that you can use to better assess whether something is worrisome for skin cancer. But the first recognition is usually from the patient or from the physician who just examines the patient.
So could a patient go through life with AK, a precancerous lesion, and it would never turn into cancer?
Yes, that's possible, but it is a marker. Like if you have AKs, it means that you've developed enough sun damage on your skin that you're prone to developing skin cancer, either in that AK spot or maybe in another spot entirely different. But it is a marker for sun damage, and it's also something that should be treated.
Okay, and if you don't catch it at the AK level, then what happens?
Then it may turn into a skin cancer, and then it goes deeper, and that's when we have to do surgery and cut the skin. See, at the level of the AK, we don't have to cut the skin. The other advantage to treating AK is depending on the treatment. Certain types of treatment for AK will actually make your skin look younger. So there's a benefit. There's a bonus.
There is a benefit. There's a bonus. I like that. And if you don't have any AK, maybe you could use it anyway.
Well, we think that prevention is the best way to go, because if you prevent the sun damage, you'll stay looking younger for a longer period of time anyway.
It's so true. And when is sun damage the most dangerous? When you're young, when you're middle-aged, when you're older?
It's dangerous any time of your life, but what we now know is that for many of these skin cancers, it's either early exposure when you're young or the total amount of exposure throughout your entire life that matters.
And what about a severe burn?
Severe burn will definitely increase your risk of developing melanoma. Just one sunburn in your life.
Melanoma as opposed to the others?
Well, melanoma, for all of them it can, but we just know that it seems that a bad sunburn early on in life really does kick your risk up a lot higher than certain other factors might.
And when I think of the days when we slathered baby oil on and added a little iodine and
aluminum foil, reflector.
Anything we could do to be tanned. And occasionally we stayed out too long and had a beer or two, and then we were red as little beets, weren't we? So not a good thing. Can this AK, can you predict if it will go anywhere, metastasize, or is it at that point? It's just the really precancerous.
AKs won't metastasize, but AKs indicate that your skin has had enough damage. So people usually have more than one AK. They have several or even dozens of AK, either at the same time or over time they'll develop more.
And do you see a day when you can buy an over-the-counter drug or lotion that you can take care of it yourself?
Yes, and there's something available already. There are good studies to show that once you've developed an AK, if you want to prevent more from developing in the future, you know what your strategy is? Use a sunscreen. If you use the sunscreen regular, you will actually prevent more AKs.
Okay, and the question is how much, how often?
Well,
what SPF?
Well, SPF, the standard recommendation is go with an SPF, sun protection factor of 30 or higher. I tend to prefer in my patients to use a 60 or higher, but use that on a daily basis before you go out. Cover all of the areas that are going to be exposed to the sun, the face, the ears, the neck, all the hands, all of those areas that are going to be exposed, and do that regularly.
Sure. Difficult for people who make their living outside.
It is.
Roofers, construction workers, especially the neck, because sometimes you forget about the neck.
It's a real occupational risk for those people, definitely.
For sure. Basal cell carcinoma. Tell me about that.
Basal cell
common type of
It
skin
is the most
cancer.
common type and that's the type of cancer that goes into your skin. And it grows. It doesn't spread to other parts of the body, so you won't have to worry about metastasis. But it can grow large. It can affect other structures. So if it's near your eye, it could start to invade your eye. If it's near your nose, it can cause damage to your nose. So it requires treatment, and it is very, very common.
It's common, but it won't kill you.
It won't kill you, but it can sure cause a lot of disfigurement. It can cause a lot of damage to your skin.
Could you have one? Could you have a basal cell carcinoma and not know it, not see it?
Believe it or not, the majority of people that have small basal cell carcinomas aren't even aware of it, and they're very slow-growing cancers. They take sometimes years to develop, and so someone can have a sore on their skin for a number of years and not realize it. They ignore it, and then once it grows to the point where it becomes difficult, that's when they show up at the doctor.
When you say a sore, it bleeds, what?
Bleeds, or it's an open, or it's weepy, or it's painful, or it gets irritated or itchy.
On the arms, mainly on the head? Where?
Anywhere on the body. Anywhere you have skin, you can have cancer, but probably the most common would be on the face and neck region.
So a lot of it's cosmetic, I understand, but some of it is medical.
Well, if we're talking about cancer, it's all medical.
Okay.
Because these things can cause damage to your skin, they can disrupt the structure and function of the skin. They are truly medical problems and they require medical treatment, no question about it.
Okay, Dr. Harvey Lui, our guest, he's a dermatologist and oncologist. When we come back, we'll talk about melanoma and squamous, is it squamous cell?
Squamous cell.
Squamous cell carcinoma.